Stephanie Terrell, owner of Simply Women's Health here in Meridian, Idaho. Today, Kelly and I are going to be talking about some procedures we do in office. So I'd like to go ahead and introduce Dr. Sajinski.
Well, I'm Dr. Kelly Sajinski here at Simply Women's Health. I'm the gynecologist. I'm the one who performs the two procedures we will be talking about, the NovaSure endometrial ablation and the iSure tubal ligation.
So Kelly, to start with, what is a NovaSure ablation?
A NovaSure endometrial ablation is essentially a procedure in which we ablate or get rid of the endometrial lining of the uterus, which is the inside lining of the uterus.
So who would be an ideal candidate for NovaSure ablation?
So the candidate for a NovaSure endometrial ablation is a woman who is having heavy menstrual periods, which may mean heavy regular menstrual periods or excessive irregular bleeding all the time.
Who would not be a good candidate then for the endometrial ablation?
So a woman who still desires to have children should not have an endometrial ablation because we need that lining for the embryo to implant and grow appropriately.
Does it help with PMS and their cramping if they have an endometrial ablation?
So the endometrial ablation does not necessarily help with cramps. Some women will notice some relief because they're bleeding less heavy, but it's not indicated to get rid of severe cramps. It also will not get rid of PMS symptoms, mood swings, because we are not changing their ovaries and they're hormonally cycling.
How effective do you think the endometrial ablation is for most women?
So the endometrial ablation is 90% effective. So about half of those women, so 45%, stop getting periods altogether. The other half have shorter, lighter periods. And then there's the 10% where it's not effective in, and that's unpredictable.
Are the patients put asleep when they have this procedure in the office?
So yes, we use an anesthesia group here in the Valley. They've been working for over 20 years. I trust them to put anyone to sleep, including myself. So patients are put to sleep using IV anesthesia, but not gas.
Okay. Do they need to be off work that day, or what's their time frame from their everyday activities?
So women who have an endometrial ablation should plan on the entire day of the procedure being off from work. They also need to arrange for another adult to do all the driving and be around with them. Most women go back to work the next day. Some take the next day off in case they don't feel well.
Do you have any other thoughts about what patients say about a NovaSure ablation, or any other questions you get asked a lot?
The NovaSure ablation, most women who have it done, their only regret is not having the ablation done sooner.
What would be the best thing for a patient to do if they're interested in the NovaSure ablation?
So if a woman's interested in the NovaSure endometrial ablation, the first step is giving us a call here at Simply Women's Health to have a consult and see if they are a candidate.